Dr. Tiny Minga, good to have you. It's so lovely to see you both with such good news, because this is a wonderful story. When did it all begin? Let's get the SABC perspective.
It goes way back, Leanne. I think from around 2008 thereabouts, there was already a discussion about starting a children's hospital.
Yeah.
And at that time, it sounded like something very ambitious. And I think what was wonderful was when Wits University came forward and said, we will donate the land. Remember, Wits Medical School has an academic section to it. And they believed that they would be able to create real value for the Children's Fund and for the rest of the continent, really, by enabling it to happen on their grounds. That's where it started. And then the big question became, now, where's the money going to come from?
Always the big question.
And that's why we're here today.
Good. I'm so glad. Tiny, you must be a happy man.
Well, I think I'm very excited, actually, about this marriage between me and my sister here.
Yeah.
It has been a long way coming.
Yeah.
But it's a short marriage, and we're going to limit it to about 5 months.
Is it 5 months?
5 months.
Okay. Fantastic. So this is not going to linger on for years. So within 5 months, are we going to see this completed? Is that what you're saying?
We're going to see many children.
Fantastic.
Within that 5 months. You know, it's a very good relationship, because through the SABC, that's why we're also excited at Mandela Children's Hospital. Through the SABC, we'll be able to reach out to the whole South African, maybe Southern African community, you know, to tell them what it's all about. We all know how Mandela is passionate about children, and he's just for children. He wants to see women and children in a better place than where they were before.
Yeah.
You know, and to build this kind of a facility has been his dream, and we have to try and make sure that we start doing this. You know, by the end of this year, August, I think we have to tend the soil, and we hope that the first admissions that we're going to have will be somewhere around 2015.
2015.
2015.
So you're hoping that the hospital will be completed by 2015?
Yes. Actually, it's long overdue.
Yeah.
You know, if you look at our situation in this country, you know, we only have 4 pediatric hospitals, dedicated hospitals in Africa, 2 of which are in Egypt. One is in Cape Town, and of course there's another one in Kenya, and Southern Africa has nothing. And that's why it was such a concern to Mr. Mandela that why can't we have a dedicated hospital for Southern Africa? So this is not only for South Africa. This is not only for Gauteng. It's for the whole of Southern Africa.
Fantastic.
And other countries, of course, they are far beyond us. If you look at America, they have about 157. If you look at Canada, they have 52. And great numbers. You know, countries who care about their children build and make sure that these facilities are available for children and mothers of these children.
Yeah. Let's get into a little bit of detail about what this memorandum of understanding is all about with the SABC. What is the SABC going to be doing?
Well, we're going to be giving full support from a media perspective to the Children's Fund. We're going to be running telethons at a certain point, just basically playing an advocacy role and saying to South Africa, if you really want to be involved in building the legacy of Madiba while he's still alive, this is a great opportunity to do that. But expanding it beyond that, to say to South Africa, look, the children are ours. You know, there's a wonderful wording that they use at the Children's Fund, and that is teaching people how to treat our children, because that's what it stands for. And if we've got kids who have diseases that cannot be managed anywhere, as you know, private clinics are extremely expensive.
Yeah.
Our public hospitals sometimes just do not have the capacity to deal with some of the serious issues that children, I mean, kids with diabetes having to queue together with adults for dialysis. Those kinds of things are really quite untenable. And having the ability to say, you know, these children are our future, and we've got to take care of them now. And we cannot wait for the parents to have money to send the child to a private clinic. We can create our own private clinic, which is accessible to the poorest of the poor. That, for me, is it's just something incredible.
I think that's a fantastic thing.
Yeah.
We don't have too much more time, but normally you handing me contracts. I'm now going to hand you contracts because I, in my hand, have the contract that's going to be signed between the SABC and the Nelson Mandela Children's Hospital. And I think you know where to sign on the dotted line.
Yeah.
This is just, I think, a partnership going forward that hopefully is going to serve a lot of children, as you say.
Absolutely.
And
Is there somebody holding the rings here?
Is there somebody?
With the rings?
With the rings?
This is the ring.
Yeah,
This is
okay.
the
This
ring.
is the ring. We're signing the rings over here. I don't think Yvonne, for those of you who don't know, Tiny is Yvonne Chaka Chaka's husband. He's her other half. So yeah, so there you have it. This is it. And you know what's also lovely is, and I have to bring Voyo into it, because, I mean, he was on the board of the Nelson Mandela Children's Fund.
Yes.
So, I mean, I think if he had to see, which he is seeing, something like this happen, I mean, this is massive. And we spoke of this at his memorial service.
Yeah. And ironically, I happen to be a trustee as well of the Nelson Mandela Children's
There you have it. So you also
as you know, Madiba would just call on anybody and say, "Come, help us." You know. So for me, it's wonderful to arrive at this point.
Yeah.
And what is even more wonderful is the SABC did not need any push from Lulama.
Yeah.
You know, there were private conversations, separate conversations being held between the Children's Fund and SABC members of staff, who then saw the light and decided they were going to run with this without me knowing anything. And I've been invited almost as a guest to this party.
Well, I'm so happy about that. And I hope that Morning Live is the first platform where we have that massive telethon.
And
we've been successful in the past.
Because we're trying to raise funds here, massive funds.
Good.
Right.
Good, to help our children here in South Africa and, as you say, past our borders as well. Thank you for joining us. Good luck with the partnership going forward. Dr. Tani Minga from the Nelson Mandela Children's Hospital, and Lulam Mkhobo, who is, of course, the GCO here at the SABC. Thank you for being our guests.